Emergency physician Dr. Willem Jooste started working at New Somerset Hospital in March this year. He'd hardly settled in when the coronavirus pandemic spread to the Western Cape. Using the triage system, patients are seen to and treated according to how sick they are.
The last month or so it's really picked up. Remember that when the patients come in, we don't know if they have COVID or not yet, mostly. Some patients do come in with a COVID positive test already, but the other patients just falls into the category where we must actually test them and see do they have COVID.
Jooste says they test on average about 20 to 30 patients a day.
These patients on average 60 to 70% do come back as positive. So there's quite a substantial number of patients that we see with COVID in the unit.
After attending to COVID-19 patients for a few weeks, Dr. Jooste himself tested positive.
I was the first staff member at our hospital to test positive. I didn't have any respiratory symptoms. I basically had a bad flu, body aches and felt sick.
After 2 weeks in isolation, he was ready to return to work.
One of the strange things that I didn't expect was the amount of guilt that you actually feel. So you feel guilty towards your family that you brought this disease home, and you felt guilty towards your colleagues because you potentially exposed them to the disease, and you felt guilty because you couldn't continue with the fight. And that was something that I was probably not really prepared for.
Jooste says no one's immune to COVID-19, and 5 of his colleagues are currently in isolation.
I don't think anybody throughout this whole journey ever felt like abandoning this process. This is what we do. There's no way that anybody that's part of this can say that we're not scared. We are scared, and I think it's the first thing to kind of recognize in yourself and say that's okay. Everybody is scared. So in emergency services, we often see violent patients. We often see sick patients with infective disease processes.
He says it's important to channel your fear in the right direction.
What makes it part of the journey is taking that fear and kind of bundling it up and using that and putting it with your passion and put it together with your love for your patients and with your enthusiasm for what you want to do and creating something new, and that is emergency care.
The support from family, friends and colleagues is what Jooste says got him through and back on his feet again, ready to serve. Ayesha Ismail, Cape Town.